I think a lot of the myths that I see relating to alopecia areata are that people think they have a poorly functioning immune system and they take supplements or they do things that they think are going to boost their immune system. A lot of autoimmune diseases like alopecia areata are not in your control, and different things that you do at home wouldn't alter the outcome. You could be a very healthy person and have an autoimmune condition, and it doesn't mean that there's anything that the patient is doing wrong. It happens, and a lot of it is genetics and other environmental factors like viral triggers or certain medications, but it's not something that you can control, and I think people have a hard time wrapping their mind around that. Alopecia areata is not caused by cancer. That is definitely a myth. A lot of times when people are on a spectrum between autoimmune disease and cancer at the other end, with autoimmune disease, your immune system's more tending towards being overactive, whereas at the opposite end, where people get cancer, their immune system is underactive and possibly does too little surveillance. So the two of them don't pair well. Alopecia areata is not caused by any certain type of hair care or lack of hair care. It's an inflammation that happens below the surface of the skin. There are different types of styling practices that can damage the hair: chemical straightening, keratin treatments, or high heat, which can cause the hair to break. But when it comes to disease of the scalp, there are things that can irritate the scalp and can make certain conditions worse, but usually are not the things that start it. Alopecia areata can affect not just your scalp, but other parts of your body, and can also affect your nails. Usually in the nails, you start to see pits in the nails, or the nails can even come off in rare cases where you stop growing nails, but you'll get what's called nail dystrophy, where the nail looks deformed and it's not a normal formed nail. I have a lot of patients that come to me and they haven't seen a doctor for years because they were once told there's nothing that can be done. And I think it's just a lack of general knowledge that there's more treatments available now. Unlike the past where people were told nothing could be done, we have good treatment now. I think medical misinformation is very dangerous. There are a lot of poor outcomes that happen as a result of people being misinformed and not getting treatment when it's needed, or assuming that their disease severity isn't enough to need treatment. I think when in doubt, see a doctor.